Hi, and welcome to the Spawdcast. My name is Carrie Hyde, and I am your host and your pet's life coach. Today, we're going to be talking about decisions, the guest that I'm bringing on is Dr. Erika Halle. Dr. Halle, how are you?
I'm doing great, thanks.
I have to point out, I know we're going to talk about dogs, but we talked about it already, but please pay attention to her fabulous her studio that she has. I think it's just so amazing, and it speaks about who she is. Like, if you just look at the background, you're going to see why she's going to be the perfect person for this podcast that we're going to be talking about, because we're going to be talking about some of the decisions that we have to make when we're dealing with an animal who can't make decisions on their own. So they can't communicate with you verbally, and they can't make decisions on their own. They can't write it down. They can't say, yes, this is what I want, no matter what decision it is. And a lot of times people think that when we talk about the decisions that you have to make with your pet, that it's just about having them when at the end of their life. But we're going to be talking about a lot more of that. And so I brought on Dr. Halle because she's going to be amazing. Dr. Halle, can you tell us a little bit just how long you've been a veterinarian, what vet school you went to, those kind of things?
Absolutely. Yeah. I've been a veterinarian for, a little over 11 years now, and I went to Oregon State University. I also got my acupuncture training while I was in vet school. So I've been practicing holistic medicine, mostly Chinese medicine, but I also do chiropractics. I dabble in some homeopathy and some other things for all of the 11 plus years that I've been a veterinarian. Additionally, important to this conversation is that I am also an animal communicator. And I don't really do that professionally, but it's a skill I have, and it's a skill that comes into the exam room with me every time that I am dealing with anything involving any animal. And certainly when we're dealing with decisions where the caretaker really doesn't know which way to go, and both ways seem, from a medical standpoint, both ways seem kind of equal, that kind of perspective can be really helpful because it gives us a little bit of an insight into what they want. Although a lot of times what we're asking is something that's a little beyond their understanding, and it's still pretty much up to us.
Yeah. So when you say an animal communicator, can you tell us a little bit about what that looks like for you when you're in an exam room with a pet?
Sure. So lots of animals, when I'm in an exam room with them, are not super chatty because they're often in kind of an anxious situation. But I can often, especially if we're dealing with something really major, I can often get a sense for where they're at. And this is really helpful in particularly end of life decisions, because a lot of times when we're trying to make a decision for, are we going to carry on with a hospice kind of situation, or is it really time for euthanasia? Is it time to make that call? Having kind of a feeling of where they're at with how they're feeling about their life can be really helpful. And a lot of it is very heavily influenced by what people have to say to me about what's happening at home, because what I see in the room is often different than what's happening at home. But usually, every time that I have a euthanasia appointment and I walk in the room, I can tell if yes, this is the right decision according to them, to the patient, or if no, it's not. And when it isn't, I always say something. I refuse to euthanize an animal that tells me it's not time, that they aren't ready.
That's interesting. That was going to be my next question. What would you do if the pet parent is saying this is time and you have an animal in front of you who's saying I'm not ready, I'm not ready?
So it really depends. If it's a situation where there's like a, oh gosh, I've had a few really tough ones where, for example, it's a large breed dog who has mobility issues and nursing care is really challenging and they're not quite ready, but it's really impossible for the family to carry on further. This is one of my favorite things to talk about with animal communication and with making decisions for animals, um, because so much shows their heart. Most of the time, when I walk into that room and we have that conversation and the animal is telling me I'm not really quite ready, when I let them know that, and they usually already know, like they're so connected to their people, they usually already know that things are challenging for their people.
Yeah.
And so usually in those cases, when I walk into the room, I'll get a message from them that is, I'm not really personally ready to go, but I'm also okay with whatever decision gets made.
I'm going to
Because
cry.
Yeah, it's challenging stuff. And they're just not as attached to life as we are generally. There have been a few cases where that's not true, but most of the time it's true. And then I've had a couple, fortunately, I think only two behavior euthanasias in my career where these dogs were just really mentally very unwell. They couldn't be rehomed because they weren't safe, and they weren't safe in the environment they were in. And neither of those dogs were themselves really ready to go. They're both physically young, healthy dogs, unfortunately, but the way that they were mentally messed up, that their mental illness was affecting them, was making it so that their life was not really that fun for them. And then again, we couldn't really put them in a better situation. So
Yeah.
there are lots of really challenging moments, and it makes it easier when I can talk to them. And honestly, the two dogs that had the mental illness and needed the behavioral euthanasias, both of them were so just out of their minds that communicating with them on any level was really challenging because they were just mostly not there. So
It's challenging I was a vet tech for many years, but I'm not an animal communicator. There's definitely instincts that I have with animals, but I
mhm.
wouldn't go so far as to say that I could communicate in the level that you're able to communicate with them. But I could tell you, I've had people come in. One of my first dogs that I got as an adult was a dog who they wanted to put to sleep for convenience.
Yeah.
And just that, knowing that was such a challenge. So, of course, me being a defiant young vet tech who thought I could do whatever I wanted, said, and I'm not saying that I did the right thing from a honest perspective. I lied and said, sure, I'd put your dog to sleep. And then I kept her forever and her name was Pebbles. And so I charged them because I was mad. I was mad that they would do this to their dog. And so I just said, okay. And then I took her in the back and told the vet, we're not putting her to sleep. I'll take her home. And I had her for many years. And for those of you who know me and have known me, you've probably met Pebbles. She was a golden retriever that I kept, and there was literally nothing wrong with her. They just told me that they didn't want to take her to the pound because they were afraid that they
Ugh.
would do studies on her. It was just inconvenient for them. So, yeah, and it was really sad. They spent a lot of money on her. Not that that mattered, but she was a purebred dog. She was gorgeous. And at some point, she was only like 5 years old.
Wow.
Yeah, and they just decided. So even not knowing that, I can't imagine how much harder it is for someone with your level of connection with animals to not only know when the pet parents are making the wrong decision, but to have the animal also say, I'm not ready. What the heck is
Oh
happening
yeah.
here?
I've had a couple where I
Oh,
just said, I'm not going to do it. You
yeah,
can
yeah,
you can find somebody else to do it if you want, but this dog is not ready and I'm not going to do it. Most of the
yeah,
time, I've only had to do that a couple of times because most of my clients are really tuned in and really very, very committed to their dogs. So there
yeah.
just isn't a lot of convenience euthanasia that comes my way, thank goodness.
Isn't it? I was under the impression it was you're not allowed to put pets to sleep for convenience. Is that
That's
something
not true,
that's not true? Oh, I
unfortunately.
wish
I
it
mean,
was.
maybe there may be local variations that
Yeah,
where it
yeah,
isn't, but certainly where I am, pets are still considered property, and you are allowed to do
sure.
with your property whatever you want within the confines of the law. And disposing of your property is something you're allowed to do. So, because of that unfortunate legal situation, yeah, a perfectly healthy dog that the people, gosh, when I was in high school working at a vet clinic, we had one of those where this, I think, 8-year-old black lab came in because her person was going into a care home where he couldn't have pets. And he was just like, well, euthanize her. And fortunately, we convinced him to
Jesus.
just turn him over to the clinic so we could
Yeah,
rehome her.
yeah,
But yeah, it happens. It absolutely does. And unfortunately, it's legal. But I'm
yeah.
fortunate I don't have to see it very often.
You're lucky. Yeah, with the clientele that you attract, I would imagine you don't have to. I worked in a very just a different kind of a clinic. But I will say this, I think I must have picked that up. Maybe the veterinarians were saying it was illegal to take it off of their plate, which is
Mm.
fine to say, legally I can, I'll lose my license if I that's probably an easier way. Cause I know I heard that from some of the vets that I worked for, and I always assumed it was true. And then of course I continued on with that because we'd get cases. We had a guy bring a boxer in one time, I remember, and I worked at this time at a very it was a very inexpensive veterinary hospital. It was a low income type area, and the boxer had been hit by a car, and he fractured his leg, and he needed a pin put in his leg or to have the leg amputated was the decisions that were made. And he said it would be cheaper to get a new dog and to just euthanize the dog. And so so being faced in those situations, I can't imagine having that dog, the little boxer. It didn't happen, by the way. The veterinarian that I worked for at the time was like, no, that's not happening. So nobody euthanized the dog. And I think we did a good job of making the guy feel like a jerk. So, which is probably unprofessional, but sometimes those emotions get in the way. So euthanasia is difficult. I actually called an animal communicator one time. For those of you, if you look at my logo you'll see a bulldog, and that was Millie, and Millie got liver cancer. And so we couldn't decide. I couldn't make the decision to when. I couldn't.
Mm-hmm.
I was struggling so hard, which is why I'm so glad we're doing this. Even though we're going to expand this out, and we're not just going to be talking about euthanasia, we're going to be talking about a lot of the other decisions that you'll get faced with when having a pet, or could get faced with. But as somebody who has been in this industry, at the time, I think I had already been in the industry 25 years. And now I'm faced with euthanizing a dog that I'm not, usually I know, but with her, I don't know what it was. I wasn't there, but I also was concerned that she was struggling. So I called an animal communicator, and there was a lot of questions that I had, including which veterinarian did she want to do the procedure. And it wasn't necessarily the vet. It was just that one would come to our house and one was where you didn't go. And so I didn't know if she felt more comfortable going to the hospital, or if she would rather have it done there with her friends around her. And so I called an animal communicator, and I'll be honest with you, at the time, I kind of thought it was being silly and what the heck am I doing? But I didn't care, because I needed support from somebody to tell me. And I didn't know the lady that I called, so I have no idea whether she was a true animal communicator but honestly, I didn't care. If somebody else could help me make that decision, I was willing to do it. So it was interesting to me. And so I'm going to ask this question, even though we're kind of directing this to animal communication, but do you think it's possible to communicate with an animal over the phone? Because I did it over the phone.
Absolutely.
It is?
Yeah,
Okay.
it's all about energy. And when I started, a lot of what I picked up on was reliant on body language and things like that. But since then, I've gotten much better as I've practiced. And it's energy. So time and space don't matter. And absolutely, the best communicator I've ever worked with is up in a fairly remote location in Canada. And she communicated with my patients when I was in Canada, and she's done a couple of my patients since I've come back to the States from Canada, and as accurate as ever, regardless of the distance.
Oh, good. I'm glad you said that, because the animal communicator, which I can't remember her name, we did it over the phone, and I always questioned whether that was possible. And so I'm glad you're telling me that, because Millie did tell her what she wanted, and we did exactly on the day she wanted. The person, we did it at work, we did it with people around, we did everything that Millie said she wanted. But I always questioned, this was over the phone, is that possible? So thanks for letting me know it is. So let's talk a little bit, euthanasia. How, other than finding someone who communicates, if we can't find an animal communicator that can communicate, what else can we do when we get faced with that decision?
So I really believe that all of us committed pet parents, as I'm sure the entire audience is in the same boat with us, all of us committed pet parents on one level or another can communicate with at least our babies, because that connection that we've built with them is really powerful. And even if you don't receive very clear, complicated communications like most professional animal communicators do, you will still know. I always tell my clients when they ask me this question that they will know. And it sounds really trite because that's a thing that we tell everybody all the time, but I have seen it happen over and over again. I've had it happen for me with my own babies. I've seen it with lots of different clients with lots of different belief systems and varying levels of belief in the weird and the the wonderful like animal communication. And there just comes a moment where you know. And the reason that you know is because they've told you. They've said, "Gosh, I'm really tired and I'd really like some help out." Because most of the time the ones that are ready to go and want some help out, they're not usually desperate. They're not usually like, "Right now, do it right now. I need to get out right now." They're usually more like, "I could keep living like this, but I'm really tired and I would really love some help out of this body." And I have to say, greater than 90% of my clients who have walked end of life journeys with their pets have picked up on that. And they have known exactly the moment when their pets told them that. And what it takes to be able to receive that message is you just have to practice holding space. And what I mean by that is looking at their situation with love and not judgment. So you're not looking at their situation thinking, "Oh gosh, that must be so terrible. Oh, what am I going to do next for them?" Those kind of thoughts, but just looking at them in the situation they're in and just being filled with love for them and not having any other thoughts of your own going on. And that is the space where you'll be able to receive messages. And that's where, when that knowing comes to you that it is time, you know that you know. And sometimes you can point to something like, a lot of times the dogs that have always had a great appetite suddenly stop eating or something like that, and they make it really obvious. But sometimes you can't. Sometimes there's nothing you can point to that says, "This is why I knew." You just knew. And I've had clients that have doubted their ability to do that, and they were really worried that their pet would tell them and they wouldn't be able to receive it. And so I've told them and their animal, while I was able to do so, that they just need to ask for it to be really obvious. Tell them that you're not sure that you're going to be able to pick up on the message. And so they need to tell you in a way that you won't be able to make a different decision. And
Wow.
every time I've had a client ask that, that is how it's turned out. And it's not usually something that's ugly and dramatic. It's usually something that there's a very obvious, like they stop eating kind of sign that makes it really clear that this is where we're going now.
Don't you think the problem, it's very interesting if I compare the two Millie situation I told you, I just couldn't. And one of those reasons why I was struggling is because she was still eating.
Mm-hmm.
She was still mostly acting right. I could tell that she had tumor on her liver, and we did ultrasounds, and it was really big. And she was older, and so there was all these signs that I knew logically she didn't have much time, but she was not having any, she was still eating. She was still getting excited when people would pet her, but every once in a while, as soon as she'd eat, she'd throw up. So I was making smaller
Mm-hmm.
meals for her. And so I thought, God, I wonder if she's in a lot of pain. But my cat, who I just recently have lost, she was 20 years old, and she stopped eating, and I had no problem. I shouldn't say no problem making that decision. Of course, I had her for 20 years, but I didn't question it. I knew it was
Mm-hmm.
time. Like, I just knew I got her blood test, and I just knew. I knew the night I brought her home, I gave her fluids, and I just knew. But I think you probably know where I'm going with this, but don't you think a lot of times those messages are, and then our emotions get in the way? Like, no, I'm crazy. Like, because I'll do that. I'll
Yeah.
say, come on, give me a sign. And then a sign will happen. And I'm like, no, that was just the wind.
Absolutely. Yes. This is a major stumbling block when any of us are learning to trust our intuition on any level for anything, is
Yeah.
that we receive the intuitive message and then we overthink it and we think, "Well, no, that can't really have been the message." So we just have to get better at taking a breath and trying to quiet our logical mind as much as we can. We'll never get it totally quiet, but try to quiet it as much as we can, and then feel in our hearts what feels like the best move. is there a move that feels the most comfortable or the most exciting or joyful? I mean, that's not usually the case in these kind of decisions, but with other decisions, it can be. Or just the one that feels the least bad in a bad situation. And yeah, sometimes it's very obvious. Sometimes they stop eating and they're done. Other times I've had patients that I've euthanized who were eating, and when I showed up, they were happy to see me and they wagged their tails and all of that, but they were still ready to go. And I've had other patients who, my own cat with kidney failure, who I lost some years ago, she did not want help until the very, very end. I think if I hadn't euthanized her when I did, when she asked for it, that she probably would not have survived that night. She would have probably died naturally that night. So she had been not eating for several days because she was already in the natural death process. So just because they stop eating doesn't mean that they're ready for help necessarily. Although for a lot of them it does, but it doesn't always mean that. Some of them still want to stick around and see what it feels like to go further than that. But like I said, for a lot of us, when they stop eating, it's very hard for us to carry on because the eating and the feeding ritual is such a huge part of how we express our love for them and how we know that they're receiving it and all of that. So most of the time when they get to the place where they stop eating, even if they're not asking to leave yet, they're usually in that place where they really feel like, I'm not quite ready, but whatever you want to do is fine for most of them. My cat was a very stubborn, independent-minded cat, and so she did not feel that way, but most of them do.
So, for our listeners, Dr. Halle and I are admins for a Facebook group called Saving Pets One Pet at a Time, which I am going to put a plug in for right here. But one of the things, I don't know if you've picked up on, I know we don't always get to see everything, but I've seen a lot of this in this group that we belong to, where people have gone to a veterinarian who has said, you need to euthanize. There's nothing else we can do for your pet. I think you need to euthanize. And then a lot of people will say, I chose not to do that, and my dog survived 2, 3, 4 years. I've seen people in that group say, they wanted me to euthanize my dog 6 years ago. So why do you think that is? Do you just think that that's a veterinarian just not knowing that there's other things, or maybe there's a lot of things, but why do you think some vets will just say euthanize?
That's really the biggest thing, because we have this gift of being able to provide our patients with euthanasia when things get bad. It's become, and this is where it was when I first entered, when I was in high school, when I entered the veterinary profession, where it was such a knee-jerk reaction. As soon as you gave someone a terminal diagnosis, one of the options you gave them right then and there was, we can euthanize. So you diagnose someone with cancer, even though they came in happy, they're still eating, they're still active, everything is still great, they just have a cancerous tumor. One of the options you gave right there and then was euthanasia. And I saw a lot of people take that option at that point. And then when I became a veterinarian and the responsibility was on me and I was delivering the diagnosis and the options, I never included that. If somebody asked about it, we might talk about it. But if someone was given a terminal diagnosis, some pet, but otherwise they were fine. They were still feeling good. They're still active. They're still living their life as normal. We just did some routine blood work or something and happened to find something really bad. My approach has always been to say, here's what's happening. Here's where it's likely to go. Here's how long it may take to get there. And here's what we can do in the meantime to give them the best quality for the longest time possible. But so many veterinarians, most of my here's what we can do in the meantime is herbs, diets, holistic stuff. So many veterinarians don't have those options. And if you aren't able to go to the university and get chemo with the oncologist or do those kinds of advanced care, which they don't, the pets don't always want that. Actually, chemo is pretty hard. But if you're not able to do that, then the next option they provide you most of the time is euthanasia, even if nobody is ready for that. And that's just, it's wonderful we have this option, because there are certainly lots of times where it's very, very helpful to relieve suffering when we're at a place where nothing else can relieve the suffering. Right. But I think that a lot of conventional vets in particular go to it too quickly. And part of why I think that is that I am a hospice vet. So my approach is usually, let's try the natural death route and see how far we get and how long we can keep them comfortable with that. And when we can't, then we have this other option. We can make this other decision.
Yeah.
So I tend to be on the other side as far as my biases of trying to stay away from euthanasia as much as possible for as long as possible.
It's one of the reasons, one of probably a million reasons why I suggest that people get a second opinion always.
Mm-hmm.
Always get a second opinion, no matter what we're dealing with, because you just don't know what baggage that veterinarian's bringing with them. And when I say baggage, I don't mean that. You don't know what tools are in their toolbox. You don't know what tools aren't in their toolbox. And so sometimes the advice they're giving you is based solely and only by what they have available in their facility. I've seen people not recommend doing, ultrasound, not because the ultrasound wouldn't be a good idea, but they don't offer it there. And so then people don't think it's available. So a second opinion, no matter what you're dealing with, I think is really, really important. Yeah. So let's start shifting this a little bit into a decision that people have to make that I often think can be a harder decision than even euthanizing an animal who's sick. And that is, what do we do when we have pets that we've had for 5-6 years that we love, and we're faced with these decisions that we might have to give them up, right?
Yeah,
rehoming
that's
them.
Such a hard one. Mm-hmm.
Rehoming them, to me, feels like it could be even harder, because especially I can imagine as an animal communicator, what is the animal going to feel when, like, what a child would feel if they're giving up? So how do you deal with those situations?
I agree. I think it's more challenging than euthanasia decision making. And I actually have personally had to make that decision myself before, and it is heart-wrenching. I think it has been the most difficult decision I have ever made regarding any of my pets in my entire life.
Yeah.
And I think that, some of it has to do with being realistic about who we are and what we're going to be able to provide versus that animal's needs. And, a lot of them are so devoted to us that they kind of don't care. They just want to be with us. And that's, for some of them, that is really the case. And you've got to take that into consideration. In my particular case, this dog that I had, when I first got divorced and I was living with someone else for a while, they had a pair of pit mixes that my dog just fell in love with. He was so head over heels in love with these two brothers of his. Aww. That when I moved out, I couldn't bear to take him away from them. I just couldn't. I had to leave him there. I felt like with him, he had been with me his entire life. He's a Doberman, and he was, I want to say he was 7 or 8 when this happened.
Wow.
So he'd been with me for most of his life at that point. And I had the feeling after he met these other two dogs and fell in love with them that he'd just been with me the rest of his life so that he could get to the place where he would meet these dogs.
Yeah.
And I felt like that for him, that was the most important thing. And I was moving into a situation where, because he was a Doberman and I was going to go rent a place, I wouldn't be able to have him for a while anyway.
Right.
But I also felt like it wasn't really fair to him to leave him there for a year or whatever and then take him away later to come back to live with me and my cats who don't really want to play with him the way the pitties want to play with him.
Yeah.
And so it's always very individual. And sometimes it's about the fact that there are other family members that it's just not going to work.
Right.
I've had clients with cats where things were maybe going well for a while, and then all of a sudden the cats decided they hated each other. And so now you've either got to, I have a couple of clients that just juggle their households. They have cats locked away in rooms, and they rotate who gets to be out, and that's really challenging for the humans, but it's also really challenging for the cats.
Right.
And I think in some of those situations that rehoming might be a good idea, but it's so challenging because unless it's someone like I was fortunate enough to be able to leave my dog with people who I knew really well, and I knew that they were super good with dogs and that he was going to be totally fine. But a lot of times we don't have that luxury, and they end up in a shelter or being rehomed to a stranger, and you do the best you can, but there's always this question of how are they now? Is
Oh my
everything okay
gosh.
now?
Yeah. Yeah.
And that's really tough.
It's really tough. And I look back on, so my cat that I lost just recently, her original name was Stella, but eventually we kind of jokingly called her Garage Kitty because she would not leave the garage. And
Mm,
looking back on it, I really think she preferred the garage because of my dog, who they
yeah,
didn't really care for each other. Neither one was mean to each other. There was no aggression towards each other, but you could tell they didn't like each other. If I was on the couch and Ansel, my dog, was with me and she came up, he'd, look at her. You could just tell the energy between the two of them was not positive. Sometimes I look back and think, I wonder if her life would have been better if I would have had her rehomed into an environment where she didn't feel better off in a garage. So, but one of the things I see a lot, which is really heartbreaking, and I wish people would stop doing, is beating people up for that decision they
mhm,
have to make. It
exactly.
angers me, and I defend people on like the Nextdoor app all the time because I Ansel, anyone who knows me knows, Ansel and I have a very codependent relationship. I love him so much. And I got to tell you, if I had to rehome him versus making that choice to euthanize him, which is never going to happen because he's going to live forever. But if I had to, I'm rehoming him without a doubt would be the hardest decision I, I could ever make. I'm preparing myself for the day that I have to maybe possibly make the decision to euthanize him. That's something that's been in the back of my head probably every day. I think about it when I look at him. Oh God, that day's coming. But it
Mhm.
never occurs to me that one day I would have to get rid of him. And what if, right? We don't know. Everybody's situation is so different, divorce. I had a West Highland Terrier that I had to get rid of when my son was a baby because when he started walking, the dog kept biting his ankles and
Mm,
it kept getting worse. And, I couldn't get the dog to stop doing it. Now I probably could. This is when I was really young, but I don't think we take into account people's situations and everybody just wants to bash people. And then what happens is these dogs people take them into dog parks and leave them there. They just leave them there
yeah.
because they're so embarrassed to take them to the shelter and say, I can no longer handle this pet. So they want to do it in the private. And that's why we have all these animals walking around. So how do we help people feel better about being in those situations and needing to rehome their pets? Let me back up. As an animal communicator, have you talked to any dogs that have had to be rehomed? Are they
Oh
adjusting
yeah,
pretty well?
absolutely. A lot of my patients are from shelters, etc., and so they have been rehomed. And for some of them, it's very hard. They don't understand what has happened, and many of them have been through 2 or 3 homes because of whatever's happening for them with their behavior or what have you. It's caused them to fail out essentially of numerous homes. And I think sometimes people are adopting a dog expecting them to be easy and they're not, but other times these dogs are not easy and the people are just not prepared for it and nobody
Right.
warned them. Behavioral testing was not adequate, or the things did not become obvious until a couple months after they got rehomed. um, and it can be really hard for them. But I also right now have a cat who went through that. He was with his first home for a year before he would return to the rescue because he wasn't cat-like enough or something, and then he ended up with us. And he's he's sad about what happened before and about having to go back to the rescue, back to the foster home, and then be with us. That's a lot of changes for him in his young life. But he's also so happy about where he's at right now that he doesn't, they remember things, but they don't tell themselves stories about them the way that we do. And they certainly can be traumatized, but again, they're not constantly telling themselves stories about their life the way that we do. So he wasn't particularly traumatized by what happened to him. And so now he's just super happy that he's here and has other cats to play with, and he feels like life is amazing. And so for him it's worked out really well. And for most of these guys, even the ones that have really bad separation anxiety from their abandonment PTSD, um, for most of them, we can help them through it, and they get so much better because
Yeah.
now they really feel like they're secure where they're at. They're not going to be abandoned, and everything's going to be okay. And it's very challenging. It's a little bit like any relationship breakdown, although of course they're more like our children than our partners
Yeah.
because of how dependent they are on us. But but like with any relationship breakdown, everyone is going to get hurt. That's just how it is. But you
Yeah.
have to think about, what does the hurt look like if we separate? And what does the hurt look like if we stay together? And which one gives each of us the best opportunity to be the happiest in the future? And it's
Well,
a tough call.
well, you make a good point when you say basically what you said is animals don't dwell on it like humans do. Because I think a lot of times with humans, we do. And I'm not saying that you can't do this, but people go on Facebook and they're constantly, you can never move forward if you're dwelling
Mm-hmm.
on the hurt and the things that happen. And so I can't imagine a dog going on Facebook and saying, my dear Facebook, my family rehomed me and I can't. But I also think about my own dog, like Ansel. Ansel was found on the street, so he wasn't necessarily rehomed, but he's happy. That dog has a life. Like I can't imagine,
Mm-hmm. Yes.
that he's unhappy. He's a challenging dog, which is why I joke about the codependency that we have, because he's challenging. He's very attached to me. But I also, he's a very attached dog. So I had, put it this way, I had to get my other golden retriever passed away that he was best friends with. But while she was going through, this is a different one than I talked to before. The other one was getting older, and I knew the time was coming. My last golden retriever was 15 years old. And so it was coming, right? And so I thought, what am I going to do? He's so attached to her. I mean, very attached to her. So what do? I
Mm-hmm.
go get another golden retriever before Joy passes away. I get Nevada, which is the other one, hoping that he wouldn't have such a loss when things were gone. And sadly, he didn't seem bothered at all. Sadly, but good. But I also thought, how attached were you? She's gone and you haven't even cried a tear. He attached to Nevada so fast. And Nevada now is his dog person. I'm his person, but it's his dog person. But then I think back, if he's is attached to whoever his owner was before me, maybe he was hurt, being lost, or how,
Mm-hmm.
I found him. I tried to find his owner, who I feel like probably didn't care that much, because I put it out there. If anyone was looking for that dog in the state of California, I gave them the opportunity and they never did come from him. But he's a type. Now Nevada, if I rehomed her, she'd be like, if they have tennis balls, I'm good. Like I don't like
Exactly. Yes.
she could care
Everyone's different.
less about me. Unless I've got a tennis ball, I'm nobody. I took her swimming. If anybody cares to watch one of these videos on my Facebook page, I took her swimming the other day, and the lady in the pool is swimming with her, and I'm trying to call her to come over to me. No, because the lady had the tennis ball. I'm chopped liver.
Mm-hmm.
So I think that's important to know too, is connecting with your animals to know how you're going to transition them. So how do we go about, like, if you have a dog like Ansel, who's a very attached dog, versus a dog, like I said, a dog like Nevada would not be hard. Bring her a tennis ball and she's good. But how would you, if you feel like, let me find a better way to ask this. If I tell my dog, and I'm not an animal communicator, if I say to Ansel, we're going to use Ansel as an example, which is never going to happen. I hope to God will never happen. But if I tell Ansel, by the way, Ansel, where are you? This is hypothetically speaking, he's here somewhere. If I were to tell Ansel I have to rehome you, and do you think he would understand that?
Absolutely.
Even though I
So
wouldn't be able to communicate back with him.
oh yeah, yeah.
Okay.
I have been talking to animals, speaking to them, telling them stories about my day and whatever for as long as I can remember.
Yeah.
And now when I do it, like I just went to see my horse this morning and I was telling her about why I hadn't been to see her last week and how hard things have been for me. I know that she gets all of that. And
Yeah.
it's not because she understands all the words. She's very smart. She understands some of the words, but she doesn't understand all the words. But when we communicate, we humans mostly do it through talking and the body language that comes along with
Right.
that. But there are so many layers beyond that. We're communicating with energy and all kinds of things that we don't really realize we're doing. So we don't know we're doing it. We're not really doing it intentionally, but it's coming along with our words and our body language, and they absolutely understand all of that. So yeah, I
So
if
don't just
I
pick them
was in
up
a
one day and drop
situation.
them off. Like have the
Right.
conversation with
Yeah,
them.
and have it be like a surprise. Oh, we're at the shelter. Oh, how fun. Look at all the other dogs. Okay, bye. See you never.
Yeah,
That
don't do
that I
that.
think is where we end up with these dogs who are really damaged by the whole procedure. And
Yeah.
certainly the ones who are very attached are going to get hurt regardless. It's
Right.
just what it's going to be. But if you explain what's happening and you explain that you love them very much, and because of whatever circumstances, it's just not possible for you to keep them with you anymore, that I think can be very helpful. And of course, if you have the very best circumstances available, then ideally these very attached dogs, you would rehome them with somebody that you know, so that you could visit them at least during the transition period, so that they know you haven't just disappeared off the face of the planet, and they can transfer their attachment to the other person while you're doing this transition. But of course, we don't always have ideal circumstances, and sometimes the best option is the shelter.
Yeah.
um, but I do think that the best way to go is to be honest with them and to tell them what is
Yeah.
happening.
When I was a very young mom. I had my son just 9 days before my 18th birthday, or after my 18th birthday. I had my son, and so I was a young mom, and I didn't know anything. And I was dropping him off at daycares, and I remember I would do that thing where you would be like, "Hey," and the babysitter would take him in the other room, and then you would sneak out, kind of thing, so they
Mm-hmm.
wouldn't cry and they wouldn't do all this stuff, and then you would sneak out and get in your car, in my case on the bus, and then you would just drive off and not give another thought. And then one day, one of the babysitters said to me, "Would you mind if we don't do that?" And I
Mm-hmm.
I, I didn't understand because I was so young. And she says, I know he's gonna cry, but I feel like it would be better if we just tell him that you're gonna be back and it's gonna be okay. And we did that, I think it took 3 days before now I know this is my son, but it took about 3 days before dropping him off was not traumatic anymore. And she said to me, "He's never going to trust you. He's never going to trust you."
Mm-hmm.
And I think back on that. How stupid was I to think I could drop my son off and sneak out and then build a trust with him? So I think it does happen with our dogs. They have to trust us.
Absolutely.
And if they're going to not trust, especially when we're talking about different species, right? Because that could encompass, you don't want an animal that can't trust humans, because then they get the fear biters and they're
Yeah.
so nervous. So if humans are taking them to the shelters and running out the door and like, bringing their balls and all their toys and making it sound like it's going to be a big old thing. It's breaking my heart that we do that to our animals and our children. Please, if you have children, don't do that to your children. I made a huge
Yeah.
mistake, but
We underestimate their intelligence and their understanding of the situation so much, both with infants and with animals.
yeah,
And certainly, in our last conversation about mental illness, there are certain things with separation anxiety and things like that where making a big deal about leaving, that's not a great plan. But
yeah,
I think that also distracting them and disappearing is not a great plan either.
right,
Whenever
right,
I am going to go anywhere longer than usual, like overnight or for a few days, I always tell each and every one of my animals, it's going to be, I'm going to go. And then after so many sleeps, I'm going to be back. And
yeah,
I don't think any of my animals care particularly, but because they all trust that I'm going to reappear at some point. And
yeah,
most of them are cats, and that's normal cat behavior to disappear for a few days and then come back to the group. But it's certainly not normal dog behavior. When dogs live socially, they don't just disappear from the group for days and then come back. Um, so I always tell them, and it's not a big deal. I tell them before I go, like, oh, there you are. I love you. I'll be back in so many sleeps. And then I'm done and I leave. So it's not this big production, but I also don't
yeah,
just disappear. And I
yeah.
think that's really important.
That is a really, really good point, because we build anxiety that way when we make a big deal around something, because
Mm-hmm.
then both our children and our animals. I know with my dogs, anytime I'm getting ready to go on vacation, the second they see that Ansel will always go sit in my suitcase. Every time I bring a suitcase out, he sits in it. I have lots of pictures of him, and it's heartbreaking. But I do have the conversation with him. I always tell him, it's not going to be that long. He gets to go. He's lucky because he is very lucky that I own a boarding facility. So he gets to go, and he knows everybody down there, but he's very attached to me. So he would rather be with me, but he knows that going to the spa is, his second home, and he gets to be around. So I just explain it to him, and things go better. Just, this is a little side note. Did you hear the story of the little Chihuahua that they found in the boot in their suitcase at the airport? Didn't know he was in there.
No.
Yeah, it was just a kind of a cute story, but I guess they were going on vacation, and someone was staying at the house with their dogs, and so they packed up all of their stuff, and I don't know, it's an older Chihuahua and a little teeny tiny one, and I don't know why they didn't see him right before they left. I have no idea what was going on in their life, so no judgment. But when they got to the airport, thankfully, their suitcase was too heavy. I'm sure it wasn't because of the Chihuahua, but the suitcase was too heavy. And so I guess they opened it up to take some stuff out, which I've done before, and found him in the husband's boot. He went in there and hid inside the husband's boot. I know, it was a cute story. And so anyway, be careful when you're packing up your suitcases, because we have these animals that are very emotional, and if they figure out that's the way they go with you, they may very well figure that out. So it was a cute story. I know, I love that. I know Ansel would do that if he could. If he could figure out a way to pretend to be a coat or something, he would figure it out. So let's talk a little bit. So we've talked about those decisions where we have to, rehome our pets. Some of the other things that we are faced with aren't necessarily euthanasia, but sometimes people have had to make those hard decisions. I had a client, boy, she was in it. She was in the hardest decision. She had, it's actually an interesting story I might do a podcast on, but she has a little Yorkie, and the Yorkie, the decision was, do I use a new kind of experimental drug for this dog's leg, or do I amputate the leg? And so most veterinarians told her to amputate. And I will be honest with you, she, of course, I shouldn't say of course, but she's been a client for years. So she asked my opinion. It's a very tiny dog. And my opinion was that possibly putting her through this, because she was going to have to take her to UC Davis to do it. She lives down in Orange County. She had to drive to UC Davis. So it was a lot of driving, in my opinion, was a lot of stress on the animal to go through that process for something that was experimental. So a lot of the vets, including myself, told her that it might be best to amputate, but she didn't. And so her dog, it was a success, and the experimental drug, and her dog was able to grow back some bone, and she moves around quite well and does quite well. But what a horrible decision to be in. I mean, that is horrible to think there's this experimental drug that I can do. How do you do that? How do you guide your clients through something like that?
These decisions are really hard. And sometimes we're not even talking, a lot of times we're not even talking about things that are experimental.
Right.
I've had a number of patients where radiation for their tumors might have been a really great option. And fortunately, we've got more local options now. But at the time, I'm up in Oregon in the Salem area. And at the time, the closest place to get radiation was UC Davis. So you had to fly down there and stay down there for a couple of weeks, however long the series of treatments was going to be, and take your dog with you, or drive down there and take your dog with you and do this. And they have to go under anesthesia each time. So they'll be still for the radiation. Right. And then immediately afterwards, while they're still dealing with the after effects of radiation, you drive home. And that's so much. It's so much for the dog. It's so much for the people.
Right.
And it is the gold standard treatment for a number of tumors. So, as far as medical advice, just from the purely medical advice standpoint, the science and the medical advice says, yes, this is the best decision. But we have to look at all aspects of the decision. And we see this with a lot of different treatment choices or diet choices or things like this, where there might be just as much science on the side of option number one as there is on the side of option number two. So, your veterinarian, from the scientific, which is the best option perspective, can't really tell you. Like, they might be able to tell you which one they have more experience with or which one they've seen more success with, but according to the science, each of them are equal. And now you have to make the decision, because ultimately the buck stops with you as the caretaker. And that's a lot, especially because in some of these situations, if you choose one option, you may not be able to do the other option. And if the first option you chose doesn't work, now you're going to be forever potentially wondering, what if I'd chosen the other option? Would it have worked? Right. And I think that the way that I coach people through this, the way I approach it myself, and how I would recommend approaching it is, again, to just, first of all, like with the rehoming situation, think about all of the aspects. So if one of the options is like the experimental treatment or the radiation, where there's a lot of stress involved, you know best, better than your veterinarian, you know best how your animal is going to respond to that situation. And of course, just because they've done well in the past with something like that doesn't mean they'll do well now, but you are the one who has the best idea about that. And of course, in the end, when you make the decision and things go well or they go poorly or neutral, I, as the veterinarian, I might be affected by that, but I'm not the one who has to live with that choice every day. The pet's caretaker is. And so that's why I don't think that anyone should be coerced into following any veterinarian's advice, including my own, if you don't feel 100% on board with it. If you have some misgivings, if you have something in you, in your gut feeling, that is saying that doesn't seem like the right path, then you should absolutely honor that. And maybe honoring that means telling your veterinarian, I feel very uncomfortable about this option. And maybe you know why you feel uncomfortable. And so you can ask some more questions and then reach a state of comfort. Or maybe you've had all your questions answered and you're still uncomfortable with it. And you just know that discomfort means that is the wrong path.
Yeah.
And ultimately, that path that's the wrong path might be gold standard treatment, whatever, but it might not be right for your dog, for you, for your relationship, for your lifestyle, all of that. There's so many factors.
So many.
So really it comes back to the same thing as the making the call as when is the good time for euthanasia. It comes back to really feeling what you feel in your heart and in your guts. And that's rough because it's not logical, but every time I have done that, or I have watched one of my clients do that, where they choose the option that feels the most comfortable for them, whatever happens always turns out okay.
Yeah.
And sure, if whatever happens is not the positive thing we'd hoped for, sometimes there's still some challenge accepting that I made this decision, this is what happened, and it's got to be okay. But just know that it is okay. And know that our pets never judge us for that. If we make the wrong decision even and things go badly, I have seen that happen a number of times, and never is there any judgment from the pets, because they know deep down that we are always doing the best that we can for them at every moment, whatever that means.
Yeah. I tell people that a lot, that, whatever decision they make will be the right one, because it's coming from a place of love, unless you're that person, and I'm going to guess that none of our listeners are, unless you're that person that's just making the decision because your pet's a burden and you don't really care.
Right.
Most of our listeners, you're going to make the right decision. But I do want to go back to where you talk about making sure it's the right decision for you, not the right decision for the veterinarian or whoever's giving you the advice. In the example I gave you of this little Yorkie, she came to me for advice, and I gave her all of what I thought financially, right? She's going to have to drive to Sacramento quite often, up there to UC Davis. Could she afford it? Could she afford the time off of work? and ultimately she made the right decision. I don't want to say it was a lucky decision. I think it was the decision she was the most comfortable with. And I think because that was the decision she was most comfortable with is why it worked out. Because
Yes.
energy, I can't tell you how many times I've had clients come to me and they're so stressed and they want me to just say everything's going to be perfect. And I don't know what it is, because this is going to sound bad, or it is what it is. My staff is amazing at what they do. I have the best staff. I know I'm not giving myself a plug. I'm just telling you they're amazing. They love the animals. But when we have that one client that doesn't trust us for whatever that reason is, it's always that dog that we mess up on.
Yes.
I don't
Yes,
know
totally.
why. I'm so glad you're kind of giggling because you've probably seen it. I'm like, how did
Been
that
there.
happen?
Yeah.
That never happens, but it happens with the one client who never trusted us from the beginning and was very apprehensive for whatever reason. I feel like that's usually something, that baggage they're bringing to the situation. Maybe they've had a bad situation somewhere else, and so they're having a trouble trusting. But if you don't trust your decision, I feel like you can create the energy around that and cause the problem. Do you agree?
Absolutely. Yes. Yes. And over, I've had, particularly with my cancer patients, where I tell people, whatever decision you make, if it's coming from love and that love continues to support this pet, and you are doing the best you can for everybody to be happy and supportive and have the best intentions at every moment, those are the situations that always turn out the best. Those dogs defy the expectations.
Yeah.
Whatever number the book says is the average survival time, they consistently exceed that, double, triple, quadruple.
Yeah.
I've had some
Yeah.
cancer patients with bone cancer, of all things. They're supposed to live maximum 13 months with no surgery and no chemo. I've had a number that have lived 3, 4. One of them went into remission, like unheard of,
Yeah.
because of where the people were at. I mean, certainly I had something to do with that a little bit too, but
Sure.
honestly, most of it is to do with where the people were at and the relationship with their dog. And that's why I always tell people, you have to make your decision. And I know a lot of veterinarians are very uncomfortable with this when they've decided which of the options they think is best and you go with a different one. And that can be, you can receive a lot of judgment from them, and that can be really hard when you're in the position of a layperson and making decisions for your pet. But if you ever find yourself there, just remind yourself that that veterinarian who's judging you right now, they don't have to live with the results of your decision every day of their life from now forward. They
Right.
might think about it at some point, but it's not going to be on their conscience, on their heart for the rest of their lives the way it will be on yours. So you have to make the decision that's right for you, or you'll
Yeah.
end up making the decision that's right for them. And if things go poorly, now you're going to be upset for the rest of your life about that decision, because it probably would have turned out differently had you made the decision that you knew was right for you.
Yeah. I think those are the veterinarians that I tell people not to go to. I hate to
Yeah.
say that, but when veterinarians are, because their egos get in the way and they feel
Mm-hmm.
like, I'm the veterinarian, I've gone to school for this long and I'm somehow smarter than you are, which I think really good veterinarians realize that the connection that people have with their animals is so invaluable to understanding what's going to happen with this animal's life.
Mm-hmm.
But so many of them just want you to just do exactly what they say. And if you don't, they get an attitude, they're upset, they guilt you, they shame you. If that ever happens, even if it's down to something as what kind of food you feed your pet, at that moment, from that very early stage, even a puppy, I tell people, if you walk in with a puppy and you want to make a decision that's different than what your veterinarian wants, and you're feeling that pressure, now's the time for you to get out and find the vet like Dr. Halle, who will understand that your final decision is kind of has to come from you, not what I can't tell you. Like, just like with the little Yorkie, I didn't tell her, oh my gosh,
Mm-hmm.
you're if you don't amputate her leg, you're crazy. In my heart at that time, I thought that it would be a lot of stress for her for an experimental, but I did also tell her, but if the experimental drug doesn't hurt her, you could still
Mhm.
amputate. She was in one of
Absolutely,
those
yeah.
good situations where worst case scenario, we ended up amputating. Um, and I look back on that a lot, and I think I'm so glad she made that decision. It worked for her, but I think, and I will repeat it, is because she had that energy surrounding her that this was going to work, and she was
Mhm.
going to drive up there, and she didn't care, and she's going to do this and stuff. So it's a really kind of a cute story, and also what is so great about that story is that she was an experiment that is actually going to help so many dogs.
Yeah.
And I think that was part of why her mom also wanted to do it, is to be a part of something, because they needed the bone to grow back. And they're using, I don't know
Mhm.
if you've heard of it, an experimental drug that helps bone grow back. And so I think, her being a part of that, and she really wanted her dog to be a part of it, was actually, it was a good thing, and it worked out for so many people. So decisions are tough when we get these dogs, right? We're going to get them, and we're going to have to make so many different decisions from what trainer to use, what kind of a trainer, right? What kind of food to feed. There's so much information out there. I mean, even dog training, who would have known that dog training was going to get so explosive, and people are so passionate, and
Yes.
I can't believe you treat training and not treat training, and you're bad if you give treats, you're bad if you don't give treats. I mean, I'm not minimizing it, but in a way I'm just letting people know, and we've seen it, and we don't need to get into dog training or anything with our excellent veterinarian, but you see how hard the decisions are. How to potty train. Potty pads, not
Mhm.
potty pads. It's just, how does somebody just get a puppy and raise them from puppy all the way to the end of their life without being inundated with the decisions that we have to make? And I think, Dr. Halle, you've done such a wonderful job of letting them know that it's going to come from within, right?
Yep, it really has to. And
Yeah,
and I don't mean to discount the science and all of that. Like
sure.
I always feel like that decision from the heart, sometimes you know right away. When I walk into a room and I present somebody with two options, sometimes they know immediately which one they want. Other
Yeah,
times they need to know all the details, and I think that's amazing. It's so important because some of those details are really important about how challenging is this going to be for you, for your pet. What kind of medication schedule is it going to be? Is it going to be pills, or whatever? You know best how that's going to work out for you. And I feel that my job as a veterinarian is to give you all of that information and then let you make your decision. And if it's not the decision I would make and I don't agree with it, well, it's not my pet. It's not my
right,
life. Just because I can pill all of my cats and probably could multiple times a day for a long period of time doesn't mean everyone
right.
can. And it
Exactly.
doesn't mean that just because you can, it doesn't mean it's not going to destroy your relationship. And that's a huge consideration as well.
Yeah.
So I have found one of the most challenging things for me in this industry is this presenting the option.
Lori, I lost her. Dr. Halle, can you still hear me? You've got some problem with some Wi-Fi. Let's see. Are you there?
Yes.
Oh, good. I got you back. Okay. Um, we'll go back to, you were talking about, the last thing I heard was presenting the options and letting that's your biggest challenge.
Yes. So presenting the options and letting the client decide. And I have to trust that if I've presented the options well and explained all of the risks and benefits of each of the paths, that whatever decision the client makes is the right decision for them. Even if
Yeah.
it's not the one I think scientifically best, even if it's not the one I would make, that's the right one for them. And I have to just let that go. And most of the time, most of my clients can make decisions I absolutely disagree with that are not abusive and neglectful. And the relationship is still fine. We're still totally good. It very rarely ends up breaking the relationship. And I really feel for people because I've had so many clients who've come from situations like this where they've made decisions like raw feeding or minimal vaccination or whatever, and it's broken the relationship with their previous vet. And I
Absolutely.
feel very sorry for them.
Yeah.
But I know that for sure exists, and it's such a challenge.
Yeah, I think that's one of the biggest relationship breakers I've noticed within the veterinary world is people are deciding, just recently, people are deciding to switch their pets off of commercial pet foods, like some of the big companies like Hills, and there's some other ones out there that people are deciding they don't want to feed their pets. And then the veterinarians are getting upset, and people are leaving these vet hospitals over it. And because the veterinarian's not finding a way to make that work for both of them. And that's really, really sad, because there are some, I don't think just because a veterinarian sells something that I don't maybe believe in, that they're absolutely going to be, this horrible veterinarian that can't provide me something good. Everyone knows I'm not a fan of that food myself, but that doesn't mean, what if I need surgery? What if he's the best surgeon in the planet? So the relationship gets broken off of one thing that we disagree with. And so it can be challenging so I this is why I love veterinarians like Dr. Halle, and you are such a rare. I wish you weren't, because
yeah.
I know it's so unfortunate that it is rare to find somebody that says, listen, this is your dog and you love them and you're responsible for them, and the decisions you make are decisions you have to. And to actually really believe that and be okay with it and say, okay, I'm going to have to adjust a little bit because they don't want to do X, Y, or Z. So let me see what will work for them. God, what an amazing relationship you end up with your clients that way, right? The trust they have that you're working together, then do what I say or out the door. You're right. It's just, and the same thing with the pet parent. I don't think that you should walk into your vet hospital and say, do what I say or I'm out the door. Right. It kind of has to work both ways, I think. And that is where we get our animals to be taken care of the best. Right. So Dr. Halle, how do our listeners get a hold of you? Because we really need more. I know you're not in the area that everybody is, but you do consultations, right? So
I do, yeah.
I'm going to say to our listeners, if you're in your vet hospital right now and you're struggling with a decision, you got to reach out to Dr. Halle, if anything, to counsel you through the decision making, because decisions are going to come up. Some of these are really, to spay and neuter your pet, hard decision. Yeah. What food to feed your pet. People would think spaying and neutering isn't a hard decision. It should be one that you research and you investigate and you're comfortable with, because there are side effects on both sides. So you need somebody like Dr. Halle who's going to walk you through those and not just go, I believe in spaying and neutering, so therefore do spaying and neutering. And then later on, when you find out that you spayed your dog and now she's got Cushing's disease or something, and it could have been caused, you're going to be upset. So I would put Dr. Halle in your back pocket and have it, unless you're in the area. Where are you in Oregon? Salem, right?
Yep, in the Salem area.
So unless you're in the Salem area, or if I were you, I would even drive an hour and a half to 2 hours or whatever it takes to get out there. But get some consultations for these decisions, because there are so many of them. We've got spay and neutering, vaccination decisions, right? We've got whether or not to put flea and tick medication on. That can be a really, really hard one, because, if you're in an area where there's ticks and then you find out that the medication is toxic. So I think you are such a valuable resource for our listeners to have to do a consultation. How would a consultation with you work if they're not in the area?
So I mostly do things on the phone in that case. I have some international clients actually where we don't use the phone because that would be very expensive. And instead we end up using Google Meet, but most of the time I use the phone. And so in order for us to have a consultation, I need records with a physical exam from within the last year. So I have some kind of data about where your dog is at, depending on what we're talking about. If we're just going to talk about some basic diet stuff. For a young, healthy dog, we may not need that, but for a lot of these things, we need that. And depending on what's happening, if we're going to be potentially talking about herbs, I like to get a picture of the tongue as well, so I can do some of the Chinese diagnostics. It's amazing what you can tell from a tongue. It's pretty remarkable. And then once we have those records, then we set up the appointment and do it over the phone. And if we're going to do herbs or supplements, anything that I'm going to provide, we mail that out or do it through an online pharmacy. So if you want to do that, you can reach out to us over the phone or by email. Our phone number is 541-740-9106. And our email is contact@healinghandspetvet.com.
Those will all be in our show notes, so you'll have those that you can scroll down. If you haven't used podcasting before, we'll have all of that information in the show notes. Dr. Halle, you are so amazing. I wish we could clone you and have you in every city. It's just so hard and frustrating for, in the area where I am. We just don't have the access to people who understand. Life in general is really hard, and we're such a judgmental society. And
Yes.
I mean, we judge people for absolutely everything. People are so afraid to even walk down the street. Quick story about judgment. I had a client bring a dog in one time to get a haircut, and we got the dog's haircut, and she loved it and thought it was the greatest haircut. She really loved the haircut. And then we got a call back 2 days later and said her neighbor doesn't like it. I thought, what? Your neighbor doesn't like the haircut? And now she was upset about it. And so we have to stop judging people, because people don't make decisions. Most people do not just go, that's what I'm going to do, and walk. Please stop judging each other and be a little bit more open to how hard it is to make these decisions, because your judgment can force somebody to make the wrong decision, which in turn can put an animal or a child or an elderly person that can't really make decisions for themselves in jeopardy. So stop passing judgment and let's let people kind of come to these decisions on their own. And please reach out to veterinarians like Dr. Erika Halle to help you if you're struggling, because someone like Dr. Halle is going to be really open-minded to going through doing these kind of decisions. So thank you. Thank you so much for giving our listeners the time and your energy, which is always so amazing. Every time I speak with you, whether it's through a podcast or we've done some other things that Dr. Halle does, I walk away so energized, and it's from your energy. So I appreciate it so much. Is there any last words?
You're so welcome.
Any last words you want to say to our listeners?
Just, I know that we actually judge gut feeling and talking about gut feeling in our society, but know that that's a superpower, being able to listen to your gut feeling and respect it, and just really build some trust in that. It may take going through some small decisions, like maybe choosing which food on the grocery store shelf that is going to be best for you. You get the gut feeling that one is going to be better than the other. Go for it. Yeah, start with the small decisions, and that will help you so that when you have these big ones that you have to make, that you'll be able to recognize the gut feeling and go with it.
That is great advice. Thank you so much. To our listeners, thank you all for listening, keeping tuned in. We're always going to be bringing you these fabulous veterinarians that are willing to basically donate their time to talk to you. So I hope you're getting valuable information from that. And we will see you next time. Thank you, Dr. Halle. Take care.
You too.